Good morning. It's Monday. Happy Monday. My mouse is acting up. That's why I couldn't um I couldn't log in real fast, but I've been fixing it. That's why I was just in the background. But anyway, it's Monday. So here comes how have you been? How are you last weekend? Okay, let me look at before our Monday motivation and presentation, okay? So our agenda for today will be our usual how are you, then the Monday motivation, and then your turn, guys, for the presentation. Okay, so let's start off with Robert this time because I don't want to save him for last this time. How have you been, Robert? How was your weekend?
I've been great. I just stayed home all day.
Really, over the weekend?
Yeah.
Oh, good job, good for you. Okay, sometimes we like staying at home so we can get things done. Did you do chores staying at home?
Yeah.
You did. Good job. Okay. What about you, Tony?
Yeah, same here. And I organized my stuff and just copying notes, that type of stuff, going over things. So not bad, pretty good.
That's good. That's good. How was Friday, by the way, at the campus? It was good. I was at the parking lot with Miss Trisha. That's why she disappeared.
We were worried for a minute.
Yeah. Don't worry. When your instructors leave the lab or the classroom, we're usually just either in the hallway or in another classroom. I had to ask her to come out because I was with my son, and I know he can come in, but I don't want him to have to go through the triage and all. Anyway, we were at the parking lot, and my son was timing it. Like, you were talking for more than an hour, just cleaning up stuff. For you guys, because I needed to get scheduled from her as to an extra day of labs from for you guys. But Friday is consistent. We've agreed that Friday will be consistent. However, Mondays and Wednesdays, Eileen, you discussed this with her, right? She's at the campus from 3 p.m. until her night class at 9:30. Okay. But night is still 10:10, really. However, since it's still hybrid and since it's still pandemic, the campus closes at 9:30. So to those of you who want to do extra labs, Mondays and Wednesdays from 3 till 5, because she starts her night class at 5. Okay? 3 till 5, Mondays and Wednesdays. Okay? I do recommend that you come, especially if you are putting in hours for IV. But Fridays is solely IV. Okay, Fridays is solely IV. I don't want you delayed going out on externship. Okay, dokes. Thanks. Kevin, where are you? Where did you eat this weekend?
So actually this weekend, unfortunately I didn't go out, but I did try. I had some poke delivered for me.
Ooh, from where?
It's called Pokeman. It's something like Pokemon. Yeah.
Like Pokemon.
And the name was interesting in itself, and the food was pretty good too. I got a bowl with tuna, spicy tuna, crab, and salmon.
Oh, that sounds good. You're making me hungry.
Seaweed and everything, so it was delicious. And then I have some sushi rolls left over from yesterday too, from that same place. So that's gonna be
now
my
you got lunch.
Today. Yep.
Yeah. So it was good. It was good. Pokemon. Which side of town is this?
I'm not too sure. I just found it on DoorDash and
DoorDash. Okay. I do Postmates. I have never tried DoorDash. I've tried Uber Eats and I've tried Postmates. Yeah.
I used to do DoorDash too, so I'm trying to be faithful with them. So.
Oh no, I didn't go deliver, but I used them. I mean, it'd be nice to try that one. I had a sub before who did I think Uber delivery or Uber Eats. She said it's fun. I get to meet people. I said, wow, interesting. Yeah, I wish. Yeah, it sounds like a cool job. Was it a cool job?
It was fun, it was just like to get a little bit of extra money on my free time. That's why I did it for a little bit. But this was back in San Diego, so I had to drive a lot more than I do if I did it here. So one time I had to drive like maybe 30 miles north because I was delivering from like San Diego up to like northern like Escondido area.
Oh my
So
God. Yeah.
yeah.
So do you pay mileage? Did they pay mileage for that?
No, but usually they tip well whoever bought from that.
Okay.
So,
So, okay. So, but you're relying on like, hopefully they give a good tip because it's a
yeah.
30
I
miles. That's
yeah.
crazy.
Mhm.
It's like from here to Charleston?
Yeah.
About. Oh my God. I wouldn't do that. You choose who you deliver to, right? The pickup.
Yes.
Oh
Mhm.
wow, you're
And
crazy. I mean,
it
unless
gives
you
you
really.
like it also gives you like what they're willing to pay and like their tip amount to.
Oh,
So
the tip is already there. So
yeah.
you're not just
Uh-huh.
banking on, I hope this gives a good.
Yeah.
I
Mhm.
gotcha. So, okay, now I get it. I was about to
Yeah.
say, unless you're really wanting to drive that 30 miles. Anyway,
Yeah.
there are days I
Yeah.
really like to drive. There are days that I just don't want to drive.
Yeah. How was your weekend, ma'am?
It was good. It was more on cleaning up, organizing, just like Tony and Robert did. I did go anywhere, just cleaning up stuff. And it felt good. And I was able to do a little bit of meal prep. Ooh.
Ooh.
And not buy it and then put it in boxes. I really cooked adobo from a recipe on YouTube. It was good. My son ate it. So if my son ate it, it's good because it's a picky eater. Anyway, Eileen, how was your weekend?
Mine was good. Just went to work yesterday. The day before, I just took my daughter out all day, just driving everywhere.
Oh, yeah.
Yeah, but
But
work.
you're like Doña Eileen. You just sit. You got a driver like Doña Eileen.
No, I'm the one who has to drive.
Oh, yesterday you had to drive.
Well, I always drive, like when we go out.
Only when you're joining class. Yes, you
Yeah.
need to drive. Okay, got it. That's good. Okay, it's hard. Like I always call moms school bus drivers because we drive our kids everywhere, especially if they have so many activities, huh? Right now, there's not much activity, so I'm not really so exhausted from driving. But before, there's like golf, soccer, it's everything, swimming. It's like, oh my God, it's like you really don't have time. But good job, mommy. What about you, Nicole? You worked over the weekend too.
I work every single weekend pretty much, and I was getting yelled
How's your
at
finger?
about broccoli. My fingers are good this
Okay.
weekend.
No bad customers this weekend?
They were all bad. I was getting yelled at about broccoli.
About broccoli?
Yes.
What dish is this?
So I work at IKEA, so it's like,
IKEA? Did you say IKEA?
yeah.
I love IKEA. Okay.
So we have the restaurant open now, so you can like do the meals, and we always like put a vegetable on their plates.
Yeah.
And we were either running out or they didn't want vegetables. And the people in front just didn't tell me that. And so they were yelling at me all weekend about broccoli, and it was fun.
It was the first weekend that the cafe is open.
It's been open for almost 2 months now.
Oh, I love the salmon. That's what I always order. Their salmon. And of course the cake. How do you call that cake? The almond.
The dime cake?
Yeah, I like that one. Anyway, maybe I'll go for a drive and get some something from there. Jess, how was your weekend? You also worked. I know that's why you didn't make it to the campus.
Yeah, I worked. Yeah, no one wants to cover my shift anymore. But I worked all weekend. They probably don't want to cover it because it's so busy now.
Yeah.
We opened, like we used to be at 50% capacity, but now we open to like 80.
Yeah.
So we much have like a full restaurant, and now instead of seating like parties of 6, I think like the most we can sit at one table is like 12 in our.
Oh, I thought the governor said May 1st, 80% capacity, and then cabanas are 8 people and dining is 8 people. So you sat 12 people?
Yeah, we would sit 12 people. So we have like a lot of like large parties and like bachelorette parties, and the weekend was like super hot and our restaurant is right next to the pool, so we just got like extra drunk people coming in. So that was my weekend.
Yeah, and it's a celebrity chef restaurant, right? So that's another one. I know it sucks. And a lot of you work on weekends only. Do you work just weekends only?
Wednesday through like Saturday mainly.
Through the weekend. Okay. What about you, Nicole? Weekends only for you?
Now I work Tuesday to Sunday.
Oh, you hit everything. So you only have one day off, which is this day.
Pretty much.
Oh wow. I always like seeing you always like freshly showered. At Ziri, sometimes at Ziri is like that, like wet hair. I don't dry my hair either. At Ziri, how was your weekend?
It was really good. I worked an early shift on Saturday, so I got out at 5. And then I went to go watch one of my brother's game because he had a soccer tournament this weekend.
Oh,
And then after the game, I went to go have dinner with some of my friends.
where'd you go?
Gorilla Sushi.
Another sushi place.
Yeah, it was really good.
Oh, cool. I don't mind traveling to try new places, like traveling 30 minutes.
Yeah, no, it was really
But
good.
everywhere is 30 minutes for me because I live far. So like the end of Henderson. So it was good.
Yeah, and then Sunday, well, it was like the finals, so we went to his game
Oh,
and he won.
hey, how old's your brother? Little one
He's 11.
is 11. Oh, about my son's age. He's 10.
Yeah.
Oh, cool, cool. I know sports are coming back. I think I'm gonna get him back to swimming, but we'll see. Are the schools going back next school year from your brother's school? What are the announcements?
Well, I think they already started to go back this year, like a couple months ago, and they sent out like an email to parents to like decide whether kids go to school or stay online.
Oh, so there's still options.
Yeah, but my mom just decided to keep him home until the end of the year.
Yeah. Well, it's the same for me too. I got the email too, virtual versus in home, and it's like the regular is once a week. What's the difference? Once a week versus nothing. It's crazy, right? So what if that once a week I want to travel? So just stay at home. Once a week is really nothing. But for you guys, announcement again, August 4th, morning students go back to the campus. Make arrangements for that full time from 8 till 12. Okay? 8 till 12, August 4th. The night class go back September 15th. September 15th. The night class, because it has to be the beginning of the sequence. Okay? I don't know exactly what sequence that will be, but we are going back. I may not be going back with you because that I'm probably going to be on PTO during that time because Miss Jaylene will be here June 20th. But that's when you go back. But I'll make sure that everything's taken care of and Miss Trisha and Miss Jaylene can run the program. Okie dokes. Now let's do our Monday motivation. This is just 8 minutes. Can you see my screen? Yes. Okay, let's do this.
There are key components and key ingredients in the recipe of a student mentality. Number one, you need to be disciplined. The future is very expensive, and only those who are carriers of discipline can inherit the future. I need you to stay motivated. I don't care if you have to listen to me 1,000 times. I need you to stay motivated. And I need that motivation to mature into discipline. I need you to be self-aware. So I need you to remember that you are always learning. In life, you are always learning. And I need you to believe in yourself. I need you to see yourself capable, lovable, and unconditionally worthy of your future. Turn your pain into progress. I need you to see yourself. See yourself. One of the things that many students lack is vision. You got to see yourself before you get there. You have to hear yourself telling yourself thank you. I need you to open up your ears. Open up your ears, because the you from the future is telling you thank you. Thank you for not giving up when you wanted to give up. Thank you for not being depressed. Thank you for not allowing the brokenness to eat your progress. Thank you, thank you, thank you. You got this. It's gonna get hard sometimes, I'm telling you right now. It's not gonna be easy, but it's worth it. Maybe you're listening to me right now and you wanna lose weight, or you try to pass the final exam, or maybe there's just this feat that seems as though it is impossible. Turn your pain into progress. Turn your pain into progress. I need you to be uncomfortable with average. I need you to be allergic to average. I need you to come to the end of yourself. So many people are depending on you. A student is hardworking. A student is mentally tough. Have the ability to adapt. Have a character, consistency. Demonstrate courage on the daily. Stay motivated. Stay positive. Earn your respect. Have a winning attitude. Breathe. Compete. Make no excuses. Set goals. Practice great habits. Stay focused. You want your future? You gotta outwork everybody on that field. You gotta outwork everybody in the room. You gotta learn how to perform under pressure. You gotta leave it all out on the field. Everybody wants the future, but everybody wants to be average. There are gonna be times when you feel like you're losing your mind, and you study for hours, and you're gonna take an exam, and you will not pass. A student is resilient. A student is disciplined. A student is committed. A student is consistent, even when they don't want to be. Because the cycle of depression needs to end with you. The cycle of not enough needs to end with you. The lack and the dysfunction and the anxiety and all of these things that your family and your father and your mother have gone through, you have to keep a student mentality. I studied and I failed the exam. I studied and I failed the test. And life is an uphill war. It is filled with tests and exams and critical moments where you are going to have to dig deep inside of yourself and ask yourself, why? Why did you start in the first place? And what was the emotion, the feeling? What was the science and the psychology behind the decision that you made? And 9 times out of 10, I can tell you why you started. You started because you were hungry. Hunger is the feeling of discomfort or weakness caused by a lack of food coupled with a desire to eat. How hungry are you? When you feel like throwing in the towel, when you feel like surrendering everything you worked for, remember why you started. Remember how you felt when you started. You were hungry. When you want to let go, when you want to surrender, when you want to stop, when you're ready to quit, when you have failed and failed again. Let me remind you what got you here. Hunger got you here. A strong desire got you here. You were desperate to break curses in your family. You were desperate to break the cycle of poverty and depression. You were desperate. Hunger got you here. Remember this. Every dream requires discipline.
One of the great
Oh,
challenges
come on.
is knowing
this.
enough about a subject to think you're right.
Every dream requires discipline. Travel the world and study students and their behaviors and their mindsets. There is a science behind achievement. And when you study the most successful students in the world, we find that they are responsible, they are motivated, they are self-managed, they are self-aware. They have a long-lasting student mentality even after they had passed the test. Because they understand that life is a test. And in life, there are ups and there are downs. And so accept the responsibility. See yourself as primarily responsible for your outcomes and your experiences. You are going to need discipline. Motivation will help you get started. But discipline is going to keep you on the road to your destiny. You're going to be self-motivated. You got to find purpose in what you do by discovering personally meaningful goals and dreams. If you're going to be a successful student, if you're going to come out on top, you got to start managing your time. You plan and you take action in pursuit of your goals and dreams. So let me tell you something. Everybody has a dream, but there is a behavior that must follow your belief system. Remember this, behavior follows belief. If you have not been able to change your behavior to match your dream, then you need to go back and examine your belief. Because 10 times out of 10, if you can't change your behavior to match your dream, then you don't believe. When somebody believes, everything changes. The time is coming where you are going to feel like giving up. But you're going to have to remember why you started. You got to dig deep and learn how to create possibilities for yourself when nobody gives you an opportunity. You have to turn your mess into your message.
So I guess your girl is a fan now. Daily Harvest literally does all the work for you. With my busy and hectic schedule, I can literally throw a flatbread in the oven or
Okay, so this is from Motivation to Study. Can you not say more? Was that good? You said it was good. Yeah? Okay. Do you still like doing our Monday motivation? Yeah. I tried to find the shortest possible one because I don't want it to be over 10 minutes. Okay. Because we do have presentation to do, but that helps. Okay. I don't have to ask you what you've learned from it or what are your insights. It's pretty straightforward. Okay. Who liked it? I like it. I wish when I was in school, though I was in school a long time, when I was in school, there's YouTube, like things like this to motivate me. Sometimes the teacher is not enough, okay? Or most of the time the teacher is not enough. That's why I try to pick, and I know a lot of the students or people now, or my son's on YouTube a lot, okay? He's on YouTube a lot, be it educational or entertainment. So, and when I think and look back, I wish we had this. I wish our professors had this type of like motivational videos and not just straight to pharmacology or straight to, yeah. So anyway, I think Monday is a good day to do it still. Okay, do you agree? Monday motivation, because it's either we had a bad weekend from irate customers, whiner customers, and the ones working in retail and customer service are smiling. And our town is a customer service oriented town, customer-oriented town. And it's a good way to reset. Okay, we're still gonna do Monday motivation. Yes? Yes? Okay. Let's go 3 minutes break to flip our switches. And then we'll start off with a presentation. I just want per chunk to breathe, for you to breathe. Okay, I can go on. Five, Jess requested 5. No. Oh, I thought you said 5. Okay, speak up. 3 minutes, okay? I thought 5 is gonna be long. Yeah, 5?
Can we please get 5?
Okay, sure. 5 minutes as per Robert's request. I thought Jeff said 5. Okay, so 5 minutes. I'll see you at 10:30. Don't be late though. So start coming in at 4 minutes, okay? So we can start presentation. See you in a bit. Okay, you guys ready? Who goes first? Kevin, then Nicole, then Aziri.
My hand was definitely up first. Oh, heck.
Okay, Kevin, will you give Nicole the chance to present first? Okay.
Let's watch a replay.
Yeah, so, okay, I know Kevin's such a gentleman. So you go first, Nicole. Kevin will be next, and Ziri will be third. That's how we're going to do it for now, okay?
Thank you, Kevin. Okay, so my drug is Carophate. So that one is actually the generic, and then the brand is Carophate. The therapeutic class is protectants, and what protectants do, they stick to the damaged ulcer tissue to protect against the acid and enzymes. The pharmacology class is gastrointestinal agents. And then the pregnancy class is B. The DE class is RX. Some side effects that you would have with this would be back pain, constipation, and dry mouth. You can also get diarrhea too. The use of this is to prevent the return of ulcers, also to like help heal the ulcers too. Some of the info is that these ulcers are located in the first part of the intestine or the small intestine. This drug is best taken on an empty stomach with a big glass of water, and you should avoid taking antacids, dairy products, and iron plus zinc supplements in 2 hours of taking it. Also, you should avoid drinking alcohol, not because there's any known interactions between the alcohol and the drug, but because it could worsen the ulcer. And with this one, you should also avoid the dragon fruit stuff again too.
Done? Okay, so a couple of things. Brand is Carophate, generic is Carophate. Okay, like what Nicole said, it's a protectant. It is protective for those who had or have ulcers. Protects it, it coats it. Okay, so this is commonly given to those with history of ulcers or if they found ulcers. Okay, pregnancy class is B, which means is it safe or not? Safe to pregnant women. It is safe because we have A to X, A, B, C, D, and X. X is do not give, A is safe. The A class, not controlled. So when you do your slides, if it's not controlled, put not controlled, and then you can put open and close parenthesis prescription only. Okay, because I want you to know that DEA class is for controlled substances only. Okay, controlled substances only. She mentioned that side effect can be constipation, dry mouth, but Nicole, you mentioned something about juice, grapefruit juice. Was it grapefruit juice? Okay, or juices in general. Did you say juices, all juices, or just grapefruit juice?
Oh, just the grapefruit juice and like dairy products to avoid too.
Yeah, avoid taking grapefruit or grapefruit juice because it affects the metabolism of the drug, correct? Good job. Any additional information on this one? No? Okay. Thanks, Nicole. Kevin. Pretty easy. It protects, coats the ulcers, okay? So it's gastro for digestive.
Alrighty, good morning, guys. So my drug for this week was Salmeterol. That is the generic. The brand is Ceravent Discus. This is one of the drugs we went over when we were doing our review for the study guide. So system, obviously respiratory. This is a inhalation device. So just like a meter dose inhaler. This is going to be taken in a similar manner. Uses asthma to prevent bronchospasms, and also to treat COPD, which is some of the most common respiratory conditions that people have. Therapeutic class, bronchodilator. Pharmacological class, it's a beta-2 agonist. Pregnancy category is C, so this can be transferred through a mom who's nursing to the offspring, to the babies. So most likely don't want to take this in conjunction with that. DA class is not controlled. It's only prescription only. It only comes in one route in administration, which is, as you see in the picture here. Adverse effects, headache, pain, nasal congestion, and just some more information here. So when you open it, you want to make sure that you put like the date you opened it on the front of the device here. There's like a little, like, I don't know if you can see it on here, but there's like 2 lines on there. So it says like used by and when it was opened. So just write the date on it. So that way, like, you can keep track of when you opened and when you're using it. Before you inhale it, and this is by mouth, just like a meter dose inhaler, you want to exhale all the excess air you already have in you. Then you put the discus, this device, to your lips and inhale the medication. You want to let it stay in for like 10 seconds for the full effect. Then you would exhale normally after those 10 seconds. Another thing is you don't want to use this more than twice per day. Use as directed, obviously, because one of the things it can do is if you use it more than once, then you can like overdose on it, and it could cause some serious side effects. It's also contraindicated to be using this in along with another beta-2 agonist, like drugs, like what's another one? Advair. So you want to make sure you only use one and not use 2, because that's another way you can get overdosed on this medication. You also want to take caution with people who have like cardiovascular disorders, because they could elevate their symptoms for like their heart rate. It can also, their blood pressure can be elevated from taking this. So yeah, and that's pretty much it for my drug this week.
Okay, good job. Like what Kevin said, we did this during the review for study guide, and we will continue with that on Wednesday, okay, when we go live on Wednesday. But going back, so this is under the respiratory system. Salmeterol is the generic, the brand, most popular brand would be the CeraVent Discus. And Kevin even explained how to use this. Kevin, is this considered a meter dose inhaler, MDI?
No, ma'am.
It's not. It's an oral inhalation only. Each blister contains 50 micrograms of salmeterol base with lactose monohydrate. When you say meter dose inhaler, for every it's pre-measured, okay? It's pre-measured. So it says in here on the important information that when opening the discus, make sure to write the date open in the front. Before inhalation, PO, exhale, put discus to your lips and inhale the medication. Let it stay in your mouth for 10 seconds to full effect, then exhale normally. Do not use more than 2 times a day. So can you say that this is a metered dose inhaler? Because each spray is pre-metered. Does it say that? So it has 1 foil strip in there. So can you say that this is a pre-metered one?
Yes, ma'am, I guess, yeah. Yeah, because every time you, each blister contains the 50 micrograms.
Yeah, so it's every time you inhale, look at the administration, 50 micrograms per inhalation, meaning they've pre-measured that for every inhale, if you do the right thing, Kai, that you're getting 50 micrograms of the drug, which is salmeterol. Okay, so it's still considered a metered dose inhaler. Okay, what is it for? Bottom line, Kevin, what is it for?
For asthma, for bronchospasms, like when you're exercising, and for COPD patients.
Okay, very good. So the therapeutic class is bronchodilator. Remember, break it down. It tells you what the drug is for. Broncho has something to do with your bronchus, bronchioles. Okay, so lungs dilates those veins because they're constricted. Okay, it can also be used to treat COPD. Pharmacological class is usually the chemical configuration of the drug. Okay, so it's beta 2 agonist. On tests on the PTCE or ExCPT, when you're asked, they usually just ask what class. Okay, so it can either be therapeutic class or pharmacological class. Okay, that's why I tell you this is a common question in the PTCE. They're going to ask you a class, but usually the class that they ask you is therapeutic class, or they want you to know both therapeutic and pharmacological class. That's why there are times wherein you're presenting and mentioning other classes on top of what you have, okay? And this is also the reason why I want you to look up both the pharmacological class and the therapeutic class, okay? But I've explained this many times and it's also on Blackboard, okay? What's the difference between pharmacological class and therapeutic class? You have to remember therapeutic class, therapy. What is it used for? It's like the medical term for what the drug is for. When you say pharmacological class, think about pharmacology. What do we study in pharmacology? So usually these are the hard to pronounce classes because they're based off of the chemical structure of the drug. That clear? Okay, thanks, Kevin. Next one would be Atziri. After Atziri, who's next? Hands up. Okay, Robert. And then Eileen, then Tony.
Okay, so my drug was Theophylline, which is the generic name. The brand name would be Theo24 or ExCPT. Those are two of common brand names. Its pharmacology class is a non-selective I can't pronounce that word.
Okay, I'll help you. Non-selective, do this with me. Phosphodiesterases. There you go.
Enzyme inhibitor. Its therapeutic class is a bronchodilator as well.
Hang on, let me give you this just in case it comes up on the PTCE. PDE. Can you see that? Phosphodiesterase enzyme inhibitor. So PDE. When you hear PDE, that's the phosphodiesterase enzyme inhibitor. Okay?
Okay, so it's used to treat asthma, bronchitis, and other problems like the chronic obstructive pulmonary disease, which is the COPD that you guys were talking about earlier. It's DEA class, it's not controlled, prescription only. Pregnancy class is C. Some side effects is nausea, vomiting, diarrhea, sleeping problems, which is insomnia, sweating, and tremors. And its system is respiratory as well.
Are you done? Don't take it down yet. Okay, very good. So this is another one. So if you're grouping your flashcards, this is another respiratory one. This is another bronchodilator one for asthma, for bronchitis, and COPD as well. Pregnancy class, it's getting higher. It's C, okay? I want you to know that, did you find, before I say it at zero, did you find anything about caffeine and theophylline?
No, I didn't.
Okay, take note. You should not take caffeine or coffee, okay, when you're on theophylline. And I want you to look that up. Why? Okay, why? I'll get back to you at Ziri while another person is presenting, because this is an important information. The PTCE once asked one of the students about theophylline and caffeine, okay? Why? Why should they not be taken together, okay? Or why should there be a warning on caffeine when you're on theophylline? Or just to make it simple, why should you not take caffeine when you're on theophylline, okay? Thanks, Atziri. Robert, you're next.
Okay. My drug is Reglan, and that is the brand. The generic is Metoclopramide. Metoclopramide. And for the therapeutic, I got Prokinetic.
Okay,
Met.
metoclopramide. Yes, you did it right.
Okay. And prokinetics are medications that help control acid reflux. And for the pharmacological, I got a gastrointestinal agent. And pregnancy categories A, so that means it's pretty safe to use if you're pregnant. It's not controlled, it's RX only. Some side effects that you can get from this could be like fatigues or headaches. It's used to treat heartburn caused by gastroesophageal reflux from medications that did not help or did not like show any effects. And it can be used to increase muscle contractions in the digestive tract to help with nausea. And you should not use this if you have muscle movement problems from Reglan or other medications that cause muscle movement problems in like your stomach or anything like that. Or if you have a movement disorder called tardive dyskinesia, and you should not use if you have ulcers or other internal stomach problems or any type of epilepsy.
Very good. Okay, this has a lot of warnings. Okay, just like any drug. Remember, I told you when you hear an ad of a drug on the radio or on TV, when they talk about the drug, it's like 2 seconds. When they talk about the side effects, it's gonna go on for the rest, which is 28 seconds or 58 seconds, depending on how long the ad is, and then including death. Okay, so do not use if you have muscle movement problems like tardive dyskinesia, ulcers, internal stomach problems, or epilepsy. Okay, these are very important information or warnings to the patient. It must be said by the pharmacist or counseled or said during counseling. Another thing, the brand is Reglan, the generic is metoclopramide. Okay, it is not controlled, it's prescription only. Okay, Robert mentioned that this is for heartburn. Okay, heartburn caused by GERD. Okay, I talked about heartburn before. I said misconception, heartburn is not a disease of the heart. Okay, it's a gastrointestinal problem. Too much acid in the stomach, the acid climbs up, stops right here on the chest. Okay, and it has that burning heaviness sensation on your chest. That's why it's called heartburn, because it stops right here on the chest. A lot of patients get rushed to the ER because they thought they're having a heart attack, okay, because there's heaviness on the chest. And then later on, after tests, they found out when they get discharged, they're going to be given drugs such as Reglan, which is for heartburn, or other heartburn medications for maintenance. Okay, so it shouldn't be surprising, but it's good that when patients say that and acknowledge that, okay, there's chest pain. Okay, but it's not always a stroke or a heart attack, but it's good to be on the safe side. We've seen a lot of patients get rushed to the ER because of heartburn, and they thought it's because of having a heart attack. So that's heartburn. That's the history of heartburn. It's not a disease of the heart. It starts from your stomach. The acid goes up. Okay. And then when you start regurgitating, it's called gastroesophageal reflux disease. Okay. And that's when you hear people or patients say, I'm throwing up in my mouth, especially at night. Okay. This happens at night. Okay. Any questions on this one? Okay. Did I say Tony or Eileen next? Thanks, Robert. Thanks, everyone who presented.
I don't remember, but I can go unless Eileen wants to.
It was me.
I love it. Okay. Usually, instructor's problem is no one wants to go. It's like we're like pulling teeth from students. I love it when it's Mondays. Like I go first. Like Nicole, if probably we're in the classroom, Nicole would be punching Kevin to get, or running in front of the board to get before Kevin, to get there before Kevin. So let's get the ladies in.
Okay, so mine is streptokinase. The brand is Streptase, which is already discontinued. Pharmacological class, I got tissue plasminogen activator, and the drug class is thrombolytic. The DA is not controlled, RX only, and pregnancy category C. And its uses is it is used to dissolve blood clots that have formed in the blood vessels. And it is used immediately after symptoms of a heart attack occur to improve patient survival. And this may also be used to treat blood clots in the lungs, pulmonary embolisms, and in the legs, deep venous thrombosis. And then this is also used to dissolve blood clots in catheters that are inserted in blood vessels. So there's a lot of use for this drug. They use it for people with doing dialysis, stuff like that. And you should consult your doctor before taking this drug because it can, some medications you cannot take while taking this drug. So that's all I have for that.
Okay, don't take it down yet. Can you hear me? Okay, don't take it down yet. So thrombolytic. Remember, I want to break this down, okay? Lysis, to kill. Think about Lysol. I keep saying this, okay? Thrombus. What's a thrombus? What's a thrombus, Eileen? You're muted.
I don't know.
Thrombus is a blood clot.
Blood clot in the vessel.
Oh.
Very good, Tony. Thrombus is a blood clot. So thrombo, blood clot, lysis kills the blood clot. So it basically kind of melts or kills the blood clot. That's why it's called thrombolytics. I'm saying this terms to you guys so that on the test, okay, on the test, you can make that educated guess. Okay, you can make that educated guess. And then, okay, so because the PTC is a multiple choice question, okay? Most tests, national examinations are, okay? And then when you're guessing, it's not just guessing out of thin air, okay? If you know that thrombus is a clot and then lysis kills, it's a thrombolytic, okay? Then you can pretty much have an educated guess or most likely pick the correct answer, even if you had no idea. As long as you context clues, in other words, okay, so that's why I'm telling you all of this roots, okay, or medical terminologies. It's not controlled, it's prescription only. The brand has been discontinued, but it's streptokinase, okay. Pharmacological class is tissue plasminogen activator, but more commonly asked is the thrombolytics. That class is what you want to remember, okay? Look at the use that Eileen put on the PowerPoint. Used to dissolve blood clot. Then I say thrombus, blood clot, lysis, kill, okay? So I'm giving you tips, Lysol kills, okay? So good job. Next one, Tony, your turn.
Can everybody hear me?
Yeah.
Cool. Okay, mine is Transdermscop. That's the brand name. The generic is Polamine. The system is the central nervous system. Its therapeutic class is antiemetic agent, meaning for nausea or vomiting. The pharmacological class is anticholinergic belladonna alkaloid. And belladonna is a plant. So that's what this is made from, I assume. It's made from the plant of using it. And it's not controlled. It's a prescription only. The dosages are 1.5 milligrams. They're patches, little patches, and the pregnancy class is C. The adverse effects are dry mouth, drowsiness, dizziness. even though it's for nausea. Treats nausea caused by motion sickness, post-operative nausea vomiting, or PONV. Apply, it's a small little patch, and you apply it behind your ear and a dry hairless spot back here behind your ear. And at least 4 hours before effect is required. So like if you're gonna go on a boat and you get motion sickness, you put it on 4 hours before and it'll help you with that. Wash hands thoroughly after handling the patch, because one side is sticky. Once you put it on, you'd wash your hands thoroughly to get it off. And let's see, I got some other information here. The patch is approximately 1 milligram over 3 days. So you can wear it for 3 days. And it's just wash hands thoroughly after use, and after removal, close the sticky sides together and then just throw it away. And, make sure then there's none left on your hands. That's all I got.
Don't take it down yet, okay?
Okay.
Okay, so scopolamine, central nervous system, antiemetic. You know antiemetic, emesis, that feeling of throwing up, nausea, and vomiting. So okay, it prevents. It's as simple as that. But the adverse effects, look at this: dry mouth, drowsiness, and dizziness. So is there a warning about the dizziness part? Usually when the side effect is dizziness or drowsiness, what's the warning? What's the usual warning? What's the usual warning? Do not operate heavy machinery, okay? Which means do not drive, or if your work entails operating heavy machinery, do not use that. Wash hands thoroughly after handling the patch. Why?
Because it'll get some in your hands and your skin will absorb it.
Your skin will absorb it, and it says in here, wash hands thoroughly after handling patch, after remove, fold sticky ends together, then wash the hands. Because the drug, is this a patch?
Yes, it's a patch.
It's a patch, okay? So it's a patch, so the drug is right there on the patch, like what Tony said. And it came from belladonna plant, which is a poison, okay? This is actually the reason why, the main reason why, okay? Fun fact, okay? Belladonna is a plant, it's a poisonous plant. Okay, here we go, next one, thank you. Eileen, I am presenting too, I forgot.
Me again?
Oh, you're done, sorry. I forgot, thrombolytic for you. Did I miss anyone? I'm trying to look at the gallery. Jess, there you go. Thank you, Jess.
Can you guys see it or no?
Yes.
Okay. Okay, so my drug was warfarin, and that is the generic brand, or that's the generic, and the brand is Coumadin or Jantovin.
Hang on. So it's warfarin, and then the brand is Coumadin.
Coumadin, yeah.
Yeah, the most popular is Coumadin. So when you see on a prescription, usually you'll see either warfarin or Coumadin. Okay.
Okay. Therapeutic class is anticoagulant, so it's the blood thinner. Pharmacology class is coumarin, vitamin K antagonist. Uses to treat or prevent blood clots in veins or arteries, which can reduce the risk of stroke, heart attack, or other serious conditions. DEA class would be RX prescription only. The pregnancy category is D, while you're pregnant. So it shows like defects in the baby while you're pregnant rather than breastfeeding. Additional info would be: do not take if you are prone to bleeding because of a medical condition or have an upcoming surgery, it will increase your risk of severe or fatal bleeding. You should not take this medication if you have high blood pressure. Foods that are high in vitamin K, such as leafy greens or like broccoli, can make the medication less effective. Grapefruit juice, cranberry juice, and pomegranate juice may interact with this medication and lead to unwanted side effects. Ask your doctor before using any medicine for pain, arthritis, fever, or swelling, such as aspirin and ibuprofen. It may affect the blood clotting and increase risk of stomach bleeding.
Very good. Okay, so a couple of things I'd like you to remember just real quick, okay? Commonly mistaken. The brand is Coumadin. The generic is warfarin, commonly interchanged, okay? Another thing, rin, suffix, rin. When you hear the rin suffix, it's called anticoagulant. Let's break it down. Anti is against, coagulant is clotting. Anti-clot. You follow? That's why most people, okay, know it as blood thinner. Because if you dissolve the clot, it kind of thins out the blood. You getting it? Okay, blood thinner. So heparin is an anticoagulant. Warfarin is an anticoagulant. You see how I'm trying to match it? The rin suffix are anticoagulants, commonly called as blood thinners. Okay. And what is that one warning on the board exam? You'll see this. Just what vitamin is not supposed to be taken with this?
Vitamin K.
Okay, take note. Vitamin K should not be taken with anticoagulants. Why? Okay, because vitamin K does the opposite. Okay, so if warfarin is a blood thinner, vitamin K is a clotting factor. Okay, but don't just think that, oh, I'm not taking a vitamin K supplement. Take note, your leafy greens, such as, okay, spinach, okay, broccoli, are rich in vitamin K. Okay, so those may interfere as well. Okay, that's why this is an interesting drug. Those may interfere as well, because what vitamin K does is it clots. And then you're taking warfarin, which is anti-clotting. Okay. Another thing that I'd like you to remember, you should be taking notes of this because it's a lot of tips for the PTCE. You should remember is vitamin K is not the same as K, which is a symbol for potassium. Okay. K is the symbol for potassium because it came from kalium, K-A-L-I-U-M, kalium, okay? And the fruit rich in potassium is bananas, okay? Vitamin K is not the same as potassium. Vitamin K interferes with blood thinners or anticoagulants, okay? Fun fact, okay? I'm taking a smoothie today, right? Okay. I used to take smoothie I've been taking smoothie probably for 5-7 years. I stopped for a year. I've been so busy, but it's not an excuse. Okay. One thing I've recommended to my students, especially, it's very common for us here who live in Vegas to have nosebleeds, especially those who are in dry weather states. Okay. And I've had a lot of students who's got nose bleeding problems. And I said, you know what, if you have nose bleeding problems, you want to take or eat a lot of leafy greens such as spinach and broccoli. Okay. And I recommended this to some students. And I said, if you like smoothie, you throw anything that you don't like in a smoothie and it'll taste good, right? And that's how you have your greens. Like, that's how I can have my greens because I'm always on the go. Used to be in the classroom, you'll only see me run or teach holding this all the time. So the students always say, here she goes, she eats her mud again, okay? Because I don't have time to eat. And then a coffee next to me. So that's usually those are my best friends. And to this day, so I have 3 cups in here. I got the smoothie, I got the coffee, and I put my water in here. Okay, so that's how I usually have it even in the classroom. But while I'm teaching, I have the smoothie. Going back to the broccoli, I told my students, if you like smoothie and you have nose bleeding problems, consume more broccoli. Okay, why? It helps with the clotting. And all the students who follow that are people who I talked to and wanted to resolve the bleeding problem. Okay, and then they started taking broccoli or putting broccoli and spinach in their smoothie. The bleeding either went away for good or it's not that bad anymore. Okay, so that's a fun fact, which is an applicable information not only for you guys, okay, but in general. Okay, who knows a family member or friends who's got that nose bleeding problems? I know a lot. I know a lot of people. Thank God my son didn't have that, even if his allergies are bad. But I have friends whose kids, they said when they wake up, they see the pillow, lots of blood. Okay, especially if they live in Vegas, Arizona, that's a common problem. Okay, and maybe you can incorporate your leafy greens or broccoli in your diet because it helps. Okay, so it helps you don't bleed so much. Okay, but like what Jess said, do not take it with warfarin, okay, or any anticoagulant because it defeats the purpose. It does the opposite. Okay, my turn. Since you guys use slides, I am going to be using my good old table just to show you that this is another way you can group it. It's in Google Word, Google Docs, but I would prefer to have it on Google Sheets because you can sort it by class. Remember I showed you that last week? You can sort your drugs, especially if you already have all the 300 drugs. Okay. Nexium. Nobody presented Nexium, but I talked about, oh, week 5. Am I wrong? This was last week. Sorry, I'm pulling up the wrong one. Right here. There you go. That's why I see Tony's forehead wrinkle. Okay, week 5, I'm sorry, Reglan, Ceravent, Singular. Okay, Singular. I talked about Singular even prior week 5, okay? Remember I told you that pink pill, pink chewable tablet, square, okay, Montelukast. A lot of the kids here in Vegas are given a prescription of that because of allergies, okay? But you will see on the product insert, on the package insert, that it is used to prevent asthma. And you're thinking, my brother, my sister only has allergies, but why used to prevent asthma? It is used to prevent asthma. But for worse forms of allergies, prescribers usually give kids the chewable Montelukast, which the popular brand name is Singular. When you hear leukotriene modifiers, it has something to do with allergies. So look here. It is given to children as young as 12 months old. Okay, meaning 1 year old. So they're chewable tablets, little square chewable tablets. Okay, and then let's jump to Sudafed. I skipped this because Kevin already presented this, right, Kevin, last time? Sudafed, brand name, generic, pseudoephedrine, but take note, Sudafed is a big brand name like Tylenol. Be careful with what you grab because there might be a duplication of prescription or drugs, okay? Sudafed comes in different forms. Sudafed comes in different active ingredients, but if it's just pseudoephedrine, that is, which is on your week 5 quiz, that is your decongestant, okay? Used to treat nasal and sinus congestion. So it's a decongestant. What did I say? People who are taking blank drugs should not take decongestant. What drugs? You remember, Kevin, since you presented it?
Blood pressure medication.
High blood pressure medication. Why? Because it
Increases it.
Pseudoephedrine, Sudafed, decongestants in general increases blood pressure. And do not take MAO inhibitors with this one as well. At Ziri, Theophylline. Did you look up Theophylline and caffeine? Can you tell us what you found out?
Yeah, so I read that if you drink caffeine with the theophylline, that it can worsen the side effects that I mentioned earlier, and it can also cause like irregular heartbeats and seizures.
Yeah, because theophylline and caffeine have similar effects. So it will increase all those side effects, okay? So theophylline and caffeine have very similar structures, okay? Take note of that. Always comes up on the PTCE. Okay, I talked about tidine and tadine, right? Tidine and tadine. So this one, ranitidine, T-I-D-I-N-E, brand name Zantac. I talked about H1 versus H2. Let's recall. I'll annotate. I am like a broken record. I am repetitive, especially on the topics that I know comes up on the PTCE. Okay. So here we go again. H1, Tony, help me out.
Antihistamines.
H1 receptor is responsible for
Allergies, antihistamines.
allergies. That's why I write it this way. H2 receptors is responsible for
Acid.
stomach acid. So H1 antagonist or H1 blockers are antihistamine, blocks allergies, stops allergies. H2 blockers are antihistamine that stops or slow down the production of stomach acid. Can you follow? So which one is tidine? T-I-D-I-N-E. Which one is tadine? Suffix. Tony?
Tidine is for acid. Tadine is for allergies.
Okay, Tidine is for acid. Tadine. Confusing, huh? Especially Americans, us, we pronounce it almost the same, right? So if it ends in tadine, like loratadine, which is Claritin, it's for allergies, correct? If it ends in tidine, then it's for acid. Let's look. Ranitidine, which is this one. H2 antagonist or H2 blocker, correct, right here, brand name Zantac, and used to treat, prevent ulcers in the stomach and in the intestine, and treats condition in which the stomach produces too much acid. Take note, these are simple information, but these are a lot of clues, okay, for the board exam. A lot of clues, short, quick info, tips, okay? Next one, let me clear my screen. Simvastatin, here comes your statins. Eileen, what are statins for? You remember? When you hear the suffix statin?
Cholesterol.
Cholesterol, okay, brand name Zocor. This is simvastatin. It's very common to see anti-hyperlipidemic. Anti is against, hyper is raised or increased. Lipid pertains to cholesterol, emia in the blood. Okay, emic becomes the drug. And then you will see commonly, most common to see on class as well, if it's a statin, HMG coenzyme A inhibitor. Okay, so used to treat elevated cholesterol levels or used in lowering elevated cholesterol levels. Okay, here we go again. Good cholesterol versus bad cholesterol. Which one is it? LDL, HDL? Tony?
HDL is good. LDL is bad.
Very good. HDL is good, high density lipoprotein. LDL is bad, low density lipoprotein. So we want the high for the cholesterol right now. Okay, any questions on the drug words? Okay, before I do abbreviation. No questions? Okay, so 2 minutes break and then we do abbreviation. Okay, just 2 minutes. Okay, so set your timers. I'm going to close my screen and then we'll do abbreviation. Can you hear me? Okay. I'm still thinking if we're gonna do, we're probably gonna do 10 minutes of math. Just finish that. Quantity to be dispensed today so that you could start off on percentages tomorrow, and then when we come back, Ms. Trisha wants to join us for percentage topic to refresh and the allegation topic to refresh. Okay, so anyway, let's do abbreviation week 5 real quick. Okay, abbreviation for cholesterol at Ziri.
For cholesterol, it's capital CHOL, and then I don't know if the period matters or not.
Yeah, COHL period. Okay, chest X-ray, Tony.
CXR.
All caps. CXR, all caps. Okay. What does COPD mean, Kevin?
COPD stands for chronic obstructive pulmonary disease.
The D is disease, not disorder, okay? Take note. So all caps. Robert, what is sublingual abbreviation?
Capital SL.
Capital S, capital L. What does sublingual mean?
Under the tongue.
Very good, under the tongue. And usually sublingual tablets or drugs take effect within?
12 minutes, 3 minutes?
Within 12 minutes, which lead me to what's the abbreviation of nitroglycerin, Eileen?
Capital N, capital T, capital G, or the nitro is the same, right?
Yeah. So it's either nitro, but more commonly abbreviated as NTG, all caps. Take note, nitroglycerin is spelled without an E at the end. NITROGLYCERIN, nitroglycerin, okay? And if it's a sublingual tablet, that's your nitrostat, which we covered. And I talked about the requirements for nitroglycerin, okay? I talked about the important information about nitroglycerin in the last session that we have. I'd like you to remember too, to not confuse NTG with NGT. NTG is nitroglycerin. NGT is nasal gastric tube. That's your feeding tube, okay? You see, if you haven't seen a family member or friend in the hospital, at least you've seen it in movies or shows. There's a tube that goes into the nose. That's why nasal or naso, all the way to the stomach, gastric. Nasogastric tube, nasal gastric tube, nasogastric tubing. Okay, it's to feed patients who cannot be fed by mouth. Okay, can you follow? So that's NGT. NTG is nitroglycerin. Last one, Jess, heart rate.
Capital H, capital R.
Good job. Capital H, capital R, heart rate. Okay. We'll end here on the drug words review. Just quick reminders. Okay. Tomorrow, Tuesday, drug words and abbreviation test. Do not forget. Set it on your phones. Put an alarm. Access opens at 7 in the morning, closes at 2 p.m. Pacific Standard Time. Okay. Do not email me that you didn't get to take the test. It's a regular thing. Every Tuesday, take the drug words and abbreviation test. Each test, you have 2 tests, is 45 minutes. Each test is 45 minutes long, okay? So plan accordingly. You can take the abbreviation first or you can take the drug words first, okay? Remember, for your abbreviation test, spelling counts, capitalization counts, okay? Punctuation counts, okay? Do not panic if you get a score of 0 or you didn't get a score. Remember, again, on Blackboard, if it's a fill in the blanks test, it has to be manually checked, okay? If it's multiple choice with repetitive answers, it has to be manually checked. So don't panic, okay? And I don't like checking it. I don't want to touch it while students are still taking it, okay? But you'll see your scores as soon as possible, usually within 2 days, okay? So don't panic. And if you have questions, feel free to email me. The access will open tomorrow as early as 7 because some of you are early risers and you got to go to work. And then I made an extension of up to 2 p.m. Okay. I will send you on a 15-minute break to breathe before we start math, which means we're going to do math for 15 minutes. Try to finish the quantity to be dispensed because we did day supply, right? Last Friday. We'll finish the quantity to be dispensed. So come Wednesday, we start fresh. We start with, no, come tomorrow, you do the percentages videos, okay? And then Wednesday, we review, okay, and do the worksheets and then allegations, okay? So come back at 10:45. I'll see you guys at 10:45, okay? Bye.